today I'm talking about SARS-CoV-2, a virus that caused COVID-19. As we all know that this virus is coming from an outbreak in Wuhan, China last December 2019, and it spreads all over the world and infecting 204 countries, and currently we have 1,002,000 cases globally. So it looks like that the virus outside of China, Wuhan, China, the virus has been exponentially spreading and is out of control. Understanding the mode of transmission of this virus is very critical in slowing down the transmission of this disease. So as we all know, the coronavirus is not named after its crown structure as glycoprotein that attaches to our host cells. Now, it has been theorized that the virus is glycoprotein will attach to ACE2 receptor or angiotensin converting enzyme 2 receptor. The alveolar type 2 cells in the lungs are concentrated or well expressed ACE2 receptor. But ACE2 receptor is also found and well expressed in our buccal cavity, in our tongue, and also in our intestine. It is also concentrated in the kidney, liver, testis is also included. Oh, the symptoms. I believe that the severity of the symptom depends on how well expressed is the ACE2 receptor. But we have another bad news coming. We believe that there's one doorway or receptor in our host cells. But lately, study shows that there's other three receptors, there's other three doors where the virus enters in our cell. The first one that we know was ACE2 converting enzyme receptor. The second, now that we studied, it is also known to bind furin receptor, which is the same receptor site for the AIDS virus. It also can also bind to GRP78 receptor, or called glucose regulated protein 78, and this receptor is actually well expressed in the endoplasmic reticulum, regulating the endoplasmic reticulum for protein folding and protein packaging. But this will come out into the surface of our cell, especially in patients with cancer cells, tumor cells. CD147 is also another receptor where the virus can also enter, and this is also well expressed in patients with cancer cells. So patients with cancer cells with any underlying conditions, heart diseases, kidney disease, are actually vulnerable. So patients with underlying disease have more of these receptors, and therefore they're more susceptible to have severe symptoms. How the virus enter into the cell? The virus is glycoprotein, contains an amino acid residue in the linker loop. These amino acids are glutamine 493 and asparagine 501. So there's two amino acid residue that has a negative charge. These glutamine 493 and asparagine 501 residue added polarity to the virus. So the S-glycoprotein now is have more polarity, so it can bind magnetically to our ACE receptor site, will enter into our host cells, the process known as endocytosis. Now, the S-glycoprotein of COVID-19 virus or SARS-CoV-2 virus has glutamine 493 residues and asparagine 501 residues. Compared to the SARS-CoV in 2003, it has only asparagine 478, while the coronavirus in the linker loop of the N-terminus or the docking site of S-glycoprotein, it contains glutamine for 93 and 501. And why this is important? Because this glutamine residue added polarity to the virus. It added, so it's now become more magnetic. It has now more polarity to the ACE2 receptor site. And we also found out that the virus, besides entering into the ACE2 converting, it can enter also into the furin receptor site. It can enter into the GRP78 and ACE, and also CD147. So there are other 3 doors where the virus can enter into our host cells, and thus makes the virus more contagious than the other coronavirus that we discovered in 2003 and also in 2013 or 14, the MERS coronavirus. So the ways to survive in COVID-19 is the number one that the CDC and the government is recommending is social distancing. 6 feet. Yes, this will work, but I don't think social distancing is enough. This is what I'm not agreeing with the CDC and with the experts in our government, Dr. Fauci. Our experts understand that this virus can infect through respiratory. Why they are only recommending wearing gloves in the public, where they know the virus can linger for 3 hours. So social distancing is not enough, because even if you distance 6 feet walking in the hallway, somebody's breathe out or breathe in or sneeze, the virus can linger up to 3 hours, 2 to 3 hours, and you're walking in the hallway of a building filled with coronavirus. So social distancing is not enough. I don't know why the government don't understand the statistics right now. It's been 3 months. Social distancing is not enough. You have to do social distancing and wear some mask. I understand the government is trying to balance the risks and reward of using the right N95 mask for only preferring to healthcare workers. But I believe that the government should mandatorily tell people to go in the public wearing masks, even mask, any kind of mask, any kind of protection to avoid spreading or lingering, to trap the droplets and avoid lingering in the public. So any kind of mask, even if it's N95, to wear in the public, I believe is a mandatory to do that to slow down the progression of the disease. But the government is hard-headed. They only recommend 6 feet distancing, which is, I don't think it's working based on the statistics right now. That we have 1,002,000 cases. It's been rising exponentially. They know that the virus can linger up to 3 hours. So even if you distance 6 feet, you're walking 6 feet in the hallway of the building filled with coronavirus, you will catch the virus, because the virus stays 2 to 3 hours in the air lingering. So the only way to slow down that one is a common sense, to do mandatory covering of your face, mask, any kind of mask, preferably N95, but since it is also reserved for the healthcare workers to take care of the positive patient, so it's best to wear any kind of mask as long as to trap the droplets in your mouth. This is what makes the government wrong in the United States. And now I've heard lately, 2 days ago, they just now talking about it by wearing a mandatory mask, according to Dr. Fauci. They just now start. I don't know when they're gonna finish talking. But I believe that social distancing is not enough. We have to wear masks, wear gloves, majority of the transmission is through respiratory. And why are you not wearing masks in the public? You go out and buy some food in McDonald's, in Burger Kings, and any other restaurants in a drive-through. When you pay, they only wear gloves. They only wear gloves. They don't wear masks. You go to Walmart, all the cashiers in Walmart are not wearing masks. They only wear gloves. And yet, they understand that the virus can go through your respiratory. You can breathe in. So they're only protecting the virus when you touch. They're not protecting the virus lingering and get inside your nostrils. So you wash your hands. The other ways to survive is you wash your hands more frequently, and also your nose more frequently, because the virus will get inside your nostrils and stays there for 3 to 5 days before it shed off and goes to your lungs. So it is, I guess, it is wise to wash your hands more often, and then maybe rinse your nose with saline. Wash your nose with saline. This saline is a salt. Now we know the virus capsid is a protein. So in our basic chemistry, saline solution can destroy the capsid by salting in and salting out effect of the salt solution. By salting in and salting out, you can destroy the capsid. So washing your nose makes sense. Wash your hands and your nose. So not only your hands and your nose. So if you go out to the public, then you rinse your nose when you come home. Wear mask when you're in the public. Any kind of mask, I believe, is essential to stop the droplets. Even handkerchief will work. Although it's not 100%, but at least it slows down the spread or the lingering of the virus in the air. You can also boost your immune system by eating alkaline food, fruits and vegetables to make your body more alkaline, because the entrance of the virus in endocytosis process requires an acidic condition. The endocytosis are well function in under acidic condition. So alkalinizing your body is essential by eating fruits. And also, if you eat fruits, some of these fruits that you eat are trypsin inhibitory food. The trypsin inhibitory food, like fruits and vegetables, can inhibit the trypsin activity when the virus gets inside the cell through the process of endocytosis. There is a digestion process of trypsin. When you inhibit the trypsin, you slows down the entrance of the virus. You slows down the endocytosis. Exercise can boost your immune system. Eating inhibitory food more often. Sorry, wrong spelling. Take zinc supplement with soybean food. Taking zinc supplement, taking zinc supplement alone will probably help very little, because by taking zinc, your zinc is only outside the entrance. You need your zinc to get inside the cell so that the zinc will inactivate the replicase, or it is called the RNA-dependent RNA polymerase. These enzymes is responsible for replication of the virus. So by taking zinc and getting zinc inside the cell, prevent or inactivate this replicase or this RNA-dependent RNA polymerase. But by taking zinc alone, the zinc cannot enter into the cell, because it is an ionic substance. You need. Thanks for your time. You want to watch some of my videos? Here are the links. Thank you very much.